White letters and a microphone appear atop gray clouds and a yellow sun. Sunstorm stories. Ebony Deloach appears on screen. Ebony defines herself as a Black woman with an intellectual disability. Ebony is a wheelchair user and wears glasses. She is a leader and peer supporter for others with intellectual disabilities.
So I did all the moving and transitioning during a pandemic. So imagine you now have to wear a mask, you can't hug anyone. I'm moving all my stuff into the van. When the guy came to my parents' house, when I got into the van, he had like tape or like a plastic shield between his seat and where I was seated in the back. And so I traveled up to Columbia, got here, worked here for a couple months, started into the job, and then about maybe 6 months into working, um, I got introduced to the the opportunity of being a disability vaccine leader, where I and other individuals of color would work with the Independent Living Center to educate and promote the vaccine and the getting of the vaccine. Now, with that promoting, we would talk about what we were hearing on the news, how we could alleviate people's fears. Once I became a disability access leader for my state, one of the most important things that we did was we had meetings to talk about what these vaccines would look like, how we would go out into the community and promote. And one of the very first things I remember from our first meeting was deciding whether we wanting to make sure that everyone was included. And by everyone, I meant like we wanted to focus and make sure that we had ASL interpreters for those that were hearing impaired. And we also wanted to make sure that we had interpreters for those in the Latino and Hispanic community. One of the biggest things that I was excited about while doing that first clinic was just getting out and meeting like everybody again and seeing everybody. This vaccine clinic was the first time that I was seeing people again and socialize. This parking lot is so full, and I'm not a person that kind of likes crowds. It's kind of hard for me to maneuver. So I remember maneuvering in, finding the room. But then once I got in the room, everyone was just so excited to see me. It had been like a whole 2 years since we started like seeing each other in person. So it was great to see all the staff members there and just get started. One of the other things that stood out to me was I also invited a friend of mine to become a vaccine leader, and we actually grew up in the same town. So he and I were able, along with the rest of the vaccine leaders, were able to participate in that clinic together. And it was just great to like partner up and be a part of that. For that day total, we were able to get, there were 30 individuals that got vaccinated, if I'm not mistaken. And it was just such a good time to network and, just network with people, to connect with people back home. It felt so warm and inviting. The one thing that stood out to me is that the community was welcoming and I felt a part of something. And if I could encourage or say anything to anyone, is just get involved, find out what's in your community. If you're not a part of an advocacy group now or don't know what's going on, get involved in advocacy and see now because we're all, in this, COVID mind space, see if things could be hybrid. Everything doesn't have to be in person. I know we all miss those personal connections, but start with see what is available in your community, in your town. If you can start a meeting, remotely, and then, if it's possible for you to get out and connect with other people, by all means do that. One of the biggest things for me that I take away from that day is we work together as a community to spread the word of, helping one another and passing on information. And I was just very proud of that. I was proud that towards the end of the day, I could slide to the front of the room and answer questions to kind of mingle more. And it really just gave me or helped me to find my voice as a leader and really educate others. And I was just really happy to do that.
5 logos appear on screen. This initiative was brought to you by the National Disability Rights Network, Seated Ground, Foundations for Divergent Minds, the Johns Hopkins Disability Health Research Center, and funded by the With Foundation. For more information or to share your story for future editions of this project, visit us at ndrn.org.